I'm Juergen Eiermann, one of the team physicians of IVFMD, one of the largest fertility service providers in the state of Florida. And I'd like to talk to you again today about the concept of and the understanding of what is ovulation all about. Ovulation, as we know it, obviously essential for accomplishing pregnancy. And it has everything to do with the maturation, the release of an egg, and the eventual hormonal changes associated with the ovulatory process, preparing the endometrium, the lining of the uterus, for implantation of an embryo. The egg, as we know it, is the most complicated cell in the human body, and the women are born with a limited number of eggs, which are gradually used up over time, and as they're of course stored in the ovaries over the years, their quality tends to undergo some deterioration with time. So let me talk to you about the indicators of ovulation. Patients come and see me and say, "Doc, how do I know that I'm ovulating, and how do I know when I'm ovulating?" Well, obviously very important. So the answer is, if you have a regular menstrual cycle, the odds are very good that you are indeed ovulating. The early signs of the maturation of an egg obviously are the development of a clear vaginal egg white type discharge, which increases towards the time of ovulation and is nothing other than the result of the production of mucus in the cervix following the rise in estrogen, which is a product of the follicle in which the egg actually matures. So then you might be interested in doing a temperature check, the so-called basal body temperature, which rises slightly just as a result of the production of the second female sex hormone called progesterone. It's not really such great of an indicator or predictor of ovulation as it is a post-dictor of ovulation. It rises after ovulation has occurred. And then, of course, the famous ovulation test kits, which we tend to use on a regular basis to document the change in a hormone level called the LH hormone, which is a pituitary hormone that is basically released by the pituitary as a result of a rapid rise in estrogen, which the pituitary realizes as, hey, the egg is mature in the ovary and wants to be released. Those are basically simple indicators that you're ovulating. Very important. There are, however, also objective means of being able to determine ovulation, and we use those in the office on a regular basis. For example, an egg matures in a follicle, and the follicle is a fluid bag that shows up on ultrasound. When we see a mature follicle, which is somewhere between 20 to 24 millimeters in diameter, we know that you are ready to ovulate. So the cervical mucus that we can identify in the cervix on ultrasound also indicates that the cervix is responding, producing mucus, which of course is there for the purpose of allowing the sperm to swim up into your reproductive tract to meet the egg. Now, after ovulation, we see the release of the egg confirmed by the collapse of a follicle, which we call a corpus luteum. We can identify that also by means of the presence of free fluid in the pelvis. So a week after ovulation, we love to check your progesterone level. Progesterone is the hormone that's named after its function, the progestation, the for-pregnancy hormone. We measure that in the morning, and there are certain levels that are indicative of normal ovulation. Also, we look at your endometrium. The lining of your uterus tells us a story. Has the hormonal change occurred? Is the lining ready for implantation? We can identify that on ultrasound. So the ovulation is important because it is what I call game day for those that want to try and get pregnant. It's important to have sperm exposure around that time. It is also important to have sperm exposure around before ovulation, as sperm tend to survive for any length of time in a supportive cervical mucus and in a supportive endometrial environment. The presence of an egg white discharge leading towards ovulation is also an invitation to intercourse, so that you can have fresh sperm around and on a regular basis are able to cover the event, which sometimes is very hard to determine exactly. So, how can we identify if we have problems with ovulation? Well, when you come to see us, we're very rigorous in determining your thyroid function, your prolactin level. We do a follicle count on ultrasound to see if there is any evidence of polycystic ovary disease, which is also somewhat indicated in the presence of in the absence of regular periods. If you are not having a period on a regular basis every 28 to 35 days or 24 to 35 days, then you have a problem with egg maturation. Polycystic ovarian disease is one of those typical conditions. We measure the androgen levels, and of course we also like to rule out insulin resistance, which is often associated with prediabetes and with obesity. The ovarian follicle count can tell us the presence of either too many follicles in polycystic ovarian disease or too little follicles. Running out of eggs is not a good situation to be in. Pelvic inflammation, like endometriosis, especially in the ovaries, can cause a problem as well and can be well identified both with blood testing as well as on ultrasound. And then there's the also important absence of, or presence, I should say, of stress. The lack of normal metabolic events that need to happen in order for your pituitary and hypothalamus to function normally to induce a normal ovulation. Stress-related anovulation has been well documented in catastrophic situations like under war circumstances or under stress in women that have bulimia or anorexia. So how can we help? Well, we can try to correct the obvious problems. We can also then push ovulation. If you need assistance in maturing an egg, we have pills, we have pituitary hormones, we have trigger shots. We use insulin modulators, both natural ones such as myo-inositol or Pregnitude, or metformin, which are also very well identified helpers when it comes to inducing more natural ovulation. Recommend stress reduction. We have the surgical option of cortical ablation in the presence of multifollicular ovaries. And we can eliminate pelvic inflammation through surgical removal or hormonal treatment of endometriosis. So much today for a quick summary on ovulation. I hope it helped you. The answers to your ongoing questions are available through consultations with any one of our physicians at IVFMD. Please see our website at ivfmd.com and let us help you.